Welcome to AmericanDraqon presents Chinese Medicine in America. My name is Joel Penner. I'm a doctor of Oriental medicine, a California acupuncturist and herbalist, and a professor of Oriental medicine. I'm also co-author of the textbook Zongfu Syndromes, Differential Diagnosis and Treatment. In this episode, we will be examining the external causes of disease. The Chinese separate the causes of disease into three categories: internal causes, which were discussed in the last episode, external causes, and neither internal nor external causes, which we can call lifestyle causes. According to Chinese medical theory, all disease or imbalance is generated internally. This means that if the internal landscape is in harmony, no external pathogenic factor can penetrate to cause disease. We see in our daily lives that some people catch cold easily, while others don't ever catch cold. This can be true even for epidemic diseases. Some people can be exposed and not get it. This can also be true of lifestyle causes. If a person is mentally and emotionally balanced, they will not abuse those substances that can cause imbalance. There are 6 external pathogenic factors. The Chinese call them the 6 climates. They are wind, cold, summer heat, dampness, dryness, and fire, which includes warmth and heat. I mentioned earlier the person's underlying constitution is a large part of the resulting symptoms. Each of the pathogenic factors has specific symptoms which are associated with it. Wind is the first and most important external pathogenic factor. Wind enters the body through the nose, mouth, and pores of the skin. It comes on quickly, so the symptoms occur abruptly and are generally acute. Wind causes the symptoms to move around, and they will change rapidly. It might start, say, with nasal obstruction and then move to a sore throat, then a cough, and so on. External wind enters the lungs and blocks lung qi, causing coughing and/or sneezing. Wind symptoms generally affect the upper body, so we see symptoms like headaches, nasal obstruction, a sore throat, or an ear infection. Wind also blocks the circulation of wei qi, or defensive qi. When that happens, symptoms occur such as neck and shoulder pain and whole body aches and pains. Wind is the vehicle through which all the other pathogenic factors enter the body. Wind can combine with cold, causing neck and shoulder pain, clear nasal discharge, and little or no fever along with the wind symptoms. If wind combines with heat, along with the wind symptoms, we see high fever and dark yellow or green nasal discharge. If wind combines with dampness, because dampness is heavy and pulls the wind downward into the channels, we tend to see body aches, skin problems, and joint pain. Wind dampness often leads to arthritic changes in the body. Wind can also combine with dryness to cause dry nasal passages, a dry throat, and dry skin. The second external pathological factor we'll talk about is cold. Cold tends to chill the body, deplete qi, and slow things down, which then results in stagnation of qi and blood. Excess cold enters the body in 2 ways. It enters with wind, as just described, or as food and drink, which will be discussed in more detail when we discuss lifestyle causes. Cold is characterized by its acute onset and severe pain. Along with affecting the lungs, it can affect the stomach, which manifests as severe abdominal cramping and diarrhea. The third external pathogen is fire. Fire also includes heat or warmth. Fire invades the head and manifests as fever. It dries the fluids, generating a dry mouth and nose and a dry, sore throat. Fire can deplete qi, blood, and yin, and in more extreme cases can affect the mind. Summer heat is our next pathogenic factor. Summer heat is what we in the West call heat stroke. Its early stage symptoms include aversion to heat, headaches, dark urine, dry lips, and thirst. In severe cases, we can see delirium, slurred speech, and loss of consciousness. The next pathogenic factor is dampness. External dampness is characterized by an acute onset. It can be brought on by a damp climate, wearing damp clothes, or lying on damp ground. Dampness is heavy, dirty, and sticky. It causes fatigue, a sensation of heaviness in the body and limbs, a feeling of stuffiness in the chest, foggy-headedness, cloudy urine, and leukorrhea. As was described earlier, wind dampness also manifests as skin problems and arthritic joint problems. The last external pathogen is dryness. External or wind dryness causes dryness throughout the body, including the lips, mouth, tongue, skin, and stools. It can also cause scanty urination. There are two other excess pathological factors. These are created by internal imbalances. They are phlegm and blood stagnation, and both are extremely frequent causes of disease. Phlegm is generated by a deficient spleen and can cause fat and plaque both in the vessels and on the teeth. It also causes stones, lumps, and masses. Blood stagnation is usually caused by chi stagnation, which is the result of emotional imbalances. Blood stagnation is the main cause of severe, internally generated pain. Finally, we will talk about neither internal nor external causes of disease. Most of these pathological factors are caused by a poor lifestyle. Some are not. We will start with those that are not. First, the underlying constitution. We are all born with certain tendencies toward physical and emotional imbalance. This is often determined by the health of our parents, which we call genetics. Constitutional problems can be counterbalanced by proper treatment. Second is trauma. Although if we are emotionally and physically in balance, we can avoid many instances of potential trauma, but no matter what we do, we all get hurt once in a while. We can also include emotional trauma since it causes the same effect of chi stagnation. Third is mistreatment. Doctor misdiagnosis and maltreatment is a frequent cause of disease. The fourth lifestyle cause is insect or animal bites. Unless we stay indoors all of the time, we are all subject to the possibility of insect or animal bites. Improper diet is another major cause of disease related to lifestyle. Improper diet can include overeating, eating improper foods for one's constitution, and not eating enough. It can also include how and when one eats. Eating in a hurry while under stress or too late at night can also create digestive problems. The final pathogenic factor that is related to lifestyle is the ingestion of poisons or parasites. All toxic substances, including both prescription and non-prescription drugs, come under the category of poisons. And of course, we are all subject to parasites, but the stronger our constitution is, the less effect they will have, and the easier they will be to eliminate. That's it for this episode, and this completes our discussion of pathology, the causes of disease. If you have questions, please contact me at joel@AmericanDraqon.com. Our next series will discuss the methods of diagnosis. I hope you enjoy it and look forward to seeing you then.